Welcome back. I'm Dr. Hawkins, and this is the 5th lesson in the first week. I've called this lesson First Aid Kit for Pain Crisis. Now, we all have pain crises. And pain crises is when you have your worst pain. When you're having that pain crisis, your mind's gone. If you're starting to have that pain, you lose sight of most things, and you're thinking, this is going to last forever. At least I do. When I've got into a pain crisis, my first thought is this is it. This is the big one. What I want to do with this chart that you're going to see in just a little bit again is to give you the tools so that you don't panic. Because our brain really does not work so well in a panic. Like any other first aid kit, it's for taking care of immediate kinds of problems to calm a crisis down. Everybody has pain crises, and sometimes the pain crisis can be created because we've done too much. But sometimes it can be the weather. Certainly, weather can cause a person's pain to go up. And pain fluctuates normal ups and downs anyway. Even in the hospital, patients do better some days than they do others when over a period of time they're getting better. So if you wake up in a day or in the middle of the day, find your pain happens to be a little bit worse than it generally is at that time of day, it may be the weather. Or it may be normal fluctuations. Everybody has had the time when they got up and they felt kind of funky, nothing worked well, and maybe your joints kind of hurt a little bit. Nothing seemed to work. You didn't move as easy as you usually do. And then the next day, maybe things are entirely different. So your pain going up may be just normal fluctuations of your physiological makeup, but heightened due to your pain condition. Now, the purpose of this chart is not to panic. To fill this chart out, you're going to fill it out when you're clear-headed, when you're not in a pain crisis, based on things that you've experienced in your following this program and in your experience with your pain. For instance, look at the first one here. The first one says, how long does your pain crisis usually last? Why is that important to know? Well, because when it starts, you know that there's an end. Even when you go to a doctor's office and they're going to give you a shot, nowadays they tell you how long that the pain is going to last. If it's going to be something like a steroid they're going to put in that's going to burn for a little bit, that may be a 4-second burn while they're injecting the steroid. They're going to tell you that so that you can hold on and you know when the end is coming. It makes it easier. So if you know whether it's a week, 2 days, 1 month that your pain crisis usually lasts, then it gives you a sense that it's not going to be forever. The other one here is, does your pain ever let up during the crisis? Now that's important to know, so that you, if it does, and it often does. Now some people report that my pain crisis, I'm in this horrendous pain for the whole week. Well, majority of that may be. And if that's so, I believe you. But for the majority of people, that pain crisis, if you pay attention, it lets up at some times. So when you're in the worst of it, it helps to know that it may get a little easier along the way. Then the other one here is the number of pain crises you've had over the last year. Why is that important? Well, it'd be important to me to know that I lasted through one of them and that things had actually gotten better in between time, so that I know if I hunker down and I do what I've learned to do to make this pain crisis, get through it, and to make it the easiest I possibly can, that maybe in 2 days I'm going to come out of this. And that it may let up a little bit during those 2 days. And that this has happened many times. This helps me not to panic. Now, the other thing here is what kind of things you want to say to yourself, the self-talk that we talked about in the session before. Now, so what are the kind of things that's going through our minds then? Well, it's, initially, if you let your mind go, it's always the big one. This is going to last forever. You do not want to allow your mind to go to helpless, defeatist kind of thoughts. You want to keep them positive, but you want to keep them reality too. And that's why you find out how often that you have them and how bad are they and how long do they last. So that you can start cleaning up some of those frightening ghost stories that you tell yourself. Instead of, this pain is killing me, which you kind of feel, you could say, no, that's not true. It's not really killing me. That all I need to do is to practice some of the things that I've learned to help, or at times, maybe just breathing. Taking some big breaths will be enough to get you through this pain crisis. Whatever your mind goes to, you want to make sure that it's realistic at that time. It's not going to kill you. And that you know how long it's going to last. You want to tell yourself, I've got some techniques to use. Now, you remember the thalamus that we talked about a few days ago? Because what you say to the thalamus, that you're in trouble, your pain's going to go up. If you say to the thalamus, because it's true, that you've got some techniques, as bad as this may seem right now, it's going to be over in a while, that you have some techniques that have worked for you, that this is not going to last forever. You're telling the thalamus that you have plans, and your pain at least will not go up. And the chances are good that when you've got a plan, you can calm yourself. Because you're saying to yourself what kinds of things you need to do during this crisis. You're going to list those relaxation techniques that work for you. Now, you have several of them during this course that you can try. There may be some that you already had, or some that you found, or some music that you listened to. That's okay. You don't have to do this the way I'm suggesting that you do it. You can do it your way. I prefer it that you do it your way. But you want to list those things that seem to work for you, and that you have them ready. When you're in a pain crisis, you don't want to go try to figure out where you left them. You want to keep those in a place that you can find them. You want a list of the images that help you. The pain-reducing images. Now, we're going in future sessions go into those images, those visualizations, and those kinesthetic kind of images, and how they can reduce your pain. But as you experience them from the tapes that you got, from the relaxation sessions, then write those down and use them to reduce your pain during a pain crisis. Then there's a list of activities that you want to avoid. I don't know how many times I hear that a person has had this pain crisis for 2 or 3 days. They come in pain, and I ask them what have they been doing the last couple of days, and what I hear from them is that they have been cleaning house, or they've been painting their bathroom, that they don't think about taking care of themselves. When you're in a pain crisis, you need a list that gives you permission. These are things I shouldn't do. There are things, of course, when you're in a pain crisis that needs to be taken care of. I'm not suggesting that every pain crisis you get in the rocking chair or you go to bed and stay. Sometimes that's where you end up. But there are things that you need to do. But you need to watch certain activities and remove them from your list of things to do. This is not a time when you're in a pain crisis to start a new project or clean a house. Sometimes during a pain crisis, this is no time to work even, to fix lunch or to cook a meal. You want, at those times, to take care of yourself. Then there is a list. The last one is a list of activities that'll be helpful for you. Sometimes people watch television. Sometimes they read books. Sometimes they talk to a friend. Sometimes they watch movies. And you need to pick out a movie that is helpful for you. And again, when you get into a pain crisis, you're not going to be thinking. So you want to have these things ready. You want to have that list of things that you can do that's helpful. You want to have that list of things that you shouldn't do, that you give yourself permission to not do. You want to know all of when these things are going to happen, how long is this going to last, what kind of thinking I need to watch out for, and what kind of thinking is going to be helpful for me, so that you have a plan. Remember, it is the thalamus that you're talking to. And whatever the thalamus determines, if you're in trouble, the pain's going up. If you got a plan, even though it is difficult, your pain can be regulated, can be reduced by the thalamus. Relaxation is following this session here, as always. I encourage you to listen to your relaxation tapes. Practice that between these sessions, not just one time after each session, but more than once, because relaxation is the building blocks of this whole program. This is Dr. Hawkins, and this finishes the first week. And I will see you next week.